Chopper, you need to share your sound.
So we are good to go, sir.
So Professor Indranil Dattu, he is currently the director of the School of Languages and Linguistics at Jadavpur University. He will be moderating the session, and Indranil sir, the platform is yours. Is he here? Oh my goodness. Hello, sir?
I think he got disconnected.
Okay.
Just we can wait for 1 minute.
I'm requesting the host to spotlight Dr. Nirmadhu Kaur, please. Okay, he's back. He's back with us. So,
can you hear me?
Yes, sir. I have introduced you. So please, the platform is yours. Please, you start the session.
Okay, I apologize for the delay. I think I did something which threw me off. So it's a great pleasure for me to welcome you all on day 3, session 19. This is the keynote lecture 14, titled Biological Rhythms, Mental Health and Happiness. We are very, very happy and privileged to have Dr. Nirmadhu Kaur. Dr. Nirmadhu Kaur is a consultant psychiatrist in Black Country Partnership NHS Foundation Trust in the West Midlands in UK. He has previously worked at Central Institute of Psychiatry, Ranchi, Mental Health Institute in Kotak, National Institute of Mental Health and Neurosciences, Bangalore, Kasturba Medical College, Manipal, India. Dr. Kaur has research interests in the field of disaster mental health with a focus on post-traumatic psychiatric disorder and preventive psychiatry. He is the author of more than 125 journal publications and book chapters. He has also written and edited 6 books. Dr. Kaur, besides being a member of the editorial boards of many journals, regularly reviews for leading medical journals as well. He's associated with Quality of Life Research and Development Foundation and Geriatric Care and Research Organization, GeriCare. He is a Life Fellow of Indian Psychiatric Society, Association of Industrial Psychiatry of India, Indian Association of Child and Adolescent Mental Health, Behavioral Medicine, Society of India, Academy of General Education, and Indian Association of Social Psychiatry. Today he'll be talking about biological rhythms, mental health, and happiness. We are very, very privileged to have him with us today. Thank you, Dr. Nirmadhu Kaur, for agreeing to give us this talk. The floor is yours.
Thank you very much for your kind words. I'll start with maybe sharing the slides. Should maybe, yeah. Are you able to see that?
Yes, sir.
Yes, doctor. Yes.
Thank you. First of all, thanks Professor Chetri, Professor Patnaik, Dr. Sanyal and Dr. Banerjee and Dr. Datta for sort of inviting me to this wonderful conference. The theme was so wonderful, that made me think there is so much about the rhythms within us and outside. And although we are sort of knowing that this is there, but we are not realizing the importance of these things. So for me, it has given a scope to realize that about these rhythms and to reflect on these things. So thanks very much for inviting. We have 40 minutes to we'll discuss, and maybe we'll take some questions after that and basically discuss. That will be better. The talk in next 30 minutes would be to explore about some of the biological rhythms and how they are linked to mental health. I think there are a lot of rhythms which are actually linked to health, life, but I will not go into that. I'll focus it more towards the mental health. And to learn from clinical sciences, the influence of interventions on the biorhythms and how that helps. I think coming as a clinician, as a psychiatrist, obviously that will be sort of my contribution. I'm not sure whether other speakers have already talked about these areas. So sorry if it is a repeat. But many times, I'm not sure how many in the audience are from clinical background. So I'll try to keep the jargons pretty low so that maybe try to make it more comprehensive. And the last one is to reflect whether we can use this understanding from clinical sciences and to improve our well-being or chance of happiness. Now, as you know, life is a conglomeration of multiple rhythms. Human beings are systems themselves, and they are living in a system which is internal, external, and there are a lot of rhythms going on within us and outside us. Realizing this is sort of pretty important, and I thank the organizers of picking this particular topic, and it affects so many things in life. Clinical side is just one of them, and it's a wonderful area to discuss, and that can help us understand a little bit more about how we are going with our lives. Now, you are pretty much aware of these rhythms, isn't it? This is a ICU monitor, and nowadays with what is happening all over the world, a lot of people have become pretty aware of them. These are the rhythms, the heart rate you can see from ECG recording. The next one is the oxygen saturation in the blood. And the third one is the respiratory rate. All these are kind of rhythms which is going on. And you see, we don't want a flat line. A flat line, no rhythm as kind of means there is no life. So to sustain life, the rhythms are there, and rhythms continue all the while from before birth till death. So we all know about these things which sustain physical life. You are very well aware of these ECGs. These are also sort of a rhythm, how our heart functioning. These are the heart racing. The top one is the normal one, and then you see the bottom two, there are arrhythmias. The rhythms go disarray, and that's a clinical concern. We all know that. And then there'll be interventions to bring them back to the normal rhythm so that the life is not at jeopardy. Like the heart, there are also brain waves, and we capture them in the electroencephalogram. And the EEGs, this is a kind of normal EEG with a lot of rhythms. And coming from brain science perspective, we'll be using a lot of these. We'll discuss when we discuss mental health. Now, when these brain waves get disarray, if you can see towards the left side, and how it has progressed, and there is spikes and waves becoming different, and this is a sign of a generalized epilepsy. So people have seizures or fits, as you know. So when the rhythms go disarray, there are problems, physical health related problems. So we all know these things a bit. Now, having these kind of rhythms going on inside our body, there are rhythms we'll talk about outside as well, how we get influenced. You know about the photic stimulation leading to epilepsy, and there are warning signs in TV and others. So then there are lot of other things like daytime hours, seasons, music, everything affects our rhythm inside. Now, having stable biorhythm synchronized the internal and external system or the environments, if we have a best fit, that means we are at ease, at comfort, and that may lead to a positive mental health when you are at ease with yourself and with your environment, and that means generate a sense of well-being and probably lead to happiness. However, all these are a bit intricate. There is no straight line stories in this, and let's try to discuss these things. As we go along in the presentation, we'll explore some of these biological rhythms and their relation to mental health and well-being in a little focused way. We'll not be discussing physical health in detail. Now, one of the important rhythms is the circadian rhythm, and it is basically a lot of biological things happen every 24 hours in a cycle. And there is a brain area, a kind of oscillator which generates these rhythms, and we see the sleep-wake cycle, the core body temperature, cortisol secretion or melatonin secretion happening at a particular time of the day, or going up and going down. And through evolution, our biological system has been very responsive to stimuli outside, and one of the most important stimuli is the light and the environment. And because the light goes up and down, and there is mornings, there are daytime, evenings, and as an organism, we get influenced by this, and our rhythms, the circadian rhythms, get influenced by it. Besides this circadian rhythms, there are, about these biological clocks, which is like organism's natural timing device, and they regulate this circadian rhythm. And these clocks are actually expressed through molecules, the proteins, and that is throughout the body. All the cells have this kind of their own biological clocks. As you know, the biological clock can get fasten, run faster, so it leads to a kind of leading to somebody leaving faster, means becoming old quicker. The progeria is a condition where somebody's biological clock or life clocks go so fast that they become old when they are still young, in a very young age. Putting everything together, there is a master clock in the brain, which basically controlling everything, all the clocks, which is known as a suprachiasmatic nucleus, and it gets direct input from the eyes, which is basically the light. Now, very recently, in 2017, you might be aware, Dr. Hall, Rosbach, and Young got Nobel Prize for their circadian rhythm research. What they found out, they isolated a gene that helps control body's clock. What does that mean? It has a far-reaching, consequences. Now, if we can control that gene, then we can slow our aging process, or it can be reversed. The picture that you are seeing there is the circadian rhythm neurons in the fruit fly brain. So they are now able to pick up, we already know in human beings where the neurons are, but they have isolated this gene. So now what will happen, if people can work on this gene, the aging can be slowed. So you can live maybe healthily longer years. Now coming to the circadian rhythm again, just as I was telling, in the day and night thing. So if you start with the say morning, 6 a.m., the cortisol secretion begins, a particular, and insulin starts with your first meal, testosterone increases around 9. A lot of things happen like this. Your greatest cardiovascular and skeletal muscle strength happen around 5 p.m. And if you see a peak in Body temperature and blood pressure is around 7 p.m. Now, 9 p.m., melatonin secretion begins. If you know, this melatonin is a hormone which is there and helps in sleep. And people, those who are above 55, if they have sleep problems, sometimes we give melatonin, and that helps. So from these rhythms and what happens at different point of time, we are now able to sort of understand and help patients who are having issues with this. Sorry, the circadian rhythms in older adults get a little different. The peaks become lower, and maybe the cycle becomes a bit slow. So as you can see, with age, there are changes with the circadian rhythm. So they might have different kind of problems. We all know with aging, a lot of different issues come up. So just wanted to highlight that the rhythm changes with age. If there is disruption to this circadian rhythm, for example, sleep-wake cycle get disturbed, or your cortisols or melatonin get the secretions and other things become slow or disturbed. And there are various adverse mental health and well-being outcomes are there. Like a lot of people may get depressed and may lead to even major depressive disorder. A lot of research indicate a circadian problem in bipolar disorder. The people who have both depression and mania at different point of time. And the easier one to understand would be the sleep-wake cycle disorder. Some people may not be able to fall asleep or sleep late, get up late, and obviously that affects life. Interestingly, all of us sometimes induce changes into the rhythm, and usually by shift work, people who have to work in the night. So that's the work-related issue. And international travel. Suppose you cover a lot of time zones and there is jet lag, which a lot of people would experience. And that's the induced change into the circadian rhythm. And many times this gets sorted soon. But if it continues, then there may be problem. And some people deliberately stay awake for work or social functions and parties. For a few days, it might be okay. But if it really continues longer, that may affect the circadian rhythm. And as you know, it is linked to brain, yeast cells there, and it can affect and lead to mental health problems. Now, as I'm talking about sleep a lot, let's see how the sleep architecture looks like. Sleep is also a kind of a rhythm there. You know, from wakeful state, and then there can be a non-REM or rapid eye movement sleep, or there is rapid eye movement sleep. So you see this stage 1, 2, 3, 4 are basically the non-REM sleeps. And then the REM sleep comes, which is kind of in yellows and all that. So in REM, we have dreams and that kind of distinguishes. And there is a rapid sort of eye movement during this REM sleeps. You can see that this continues in a waveform. In the beginning of sleep, there is less REM. Toward the end, it becomes more REM. So if your late part of early morning sleep is, if it is affected, you are affecting more of REM sleep. While this NREM is more reparative or restitutive, gives you rest, but REM is kind of rejuvenative. It prepares you for the next day. So both these phases are important for human beings, and one should have a good sort of sleep, very deep sleep or satisfactory. The quality of sleep should be good to maintain your rhythm, circadian rhythm, and obviously a proper mental health. If you can very easily understand that if your sleep is disturbed, the next day becomes maybe irritating, your mood may not be very good, you may be drowsy, there may be lack of concentration, a lot of things is affected by not having a good night's sleep. I'll not go into these details, but But I just wanted to highlight that when we sleep, our brain waves also becomes different. If you see from the stage 1, how it was, fast activities were there, and then gradually the easy activities also changes in different sleep stages. So the rhythm elsewhere also changes. Okay, I think now sleep disturbances were very common. Insomnias are almost 10 to 30% of general population. In some studies say they have insomnia. And we all do get sleep problems occasionally. And these sleep problems are mostly, we do not get into sleep, or get up early when there is still time. So, but in some studies, almost half of the population studied reported some sort of insomnia. There are a lot of other sleep disturbances like sleeping more or disorder of sleep cycle, sleepwalking, terrors, a lot of things happen. And these disorders are known to affect mental health. Similarly, this happens every day. Now, the menstruation cycle happens every month. So we all know that this continues from menarche to menopause as a part of a life cycle the women go through. And in this menstrual cycle as well, there are so many different hormones go through a rhythmical fashion, like progesterone, luteinizing hormone, estradiol or FSH, the follicle stimulating hormones, all have their own dance there in their rhythms. And if it goes on well, that's fine. If it isn't, there may be problems with menstruation that may affect stress. And as you know, stress may affect menstruation as well. So there is a very, very intricate relationship between the stress and menstruations. And you may know about premenstrual tension, and then sometimes it may lead to now a premenstrual dysphoric disorder, which is kind of starts 1 or 2 weeks before, and then goes on to have different kind of symptoms, mood, bodily symptoms, and cognitive symptoms like concentration difficulties, forgetfulness. So it is pretty well known, and while 3 to 8% of people, ladies would have this, but much more proportion of ladies would have some sort of symptoms linking to this, or premenstrual syndrome. Now, coming to from the monthly thing, let's go into what happens in seasons. As you know, seasons come with different colors, and then mood changes as well. And we know what is the difference, the light or length of the day, which is more in summer and less in winter, and that affects human beings being in the system. And there are a lot of seasonal variations of illness. And the interesting one is the seasonal affective disorder, which a lot of people suffer from. And the seasonal affective disorder is basically a recurrent major depressive disorder with a seasonal pattern, usually beginning in the fall and continuing into winter months. So a lot of people kind of remain depressed during this. When it is happens in a smaller scale, we know that as a winter blues. A lot of people remain depressed, miserable, and then they need help. And because we have now understood, because light comes down, number of hours of the day comes down, there are therapy, which is light therapy. We'll discuss a little bit about that, and that helps. And there is a seasonal suicide peak as well in spring. It's very consistently reported in many studies. If you can see this graph, in the spring, say March, April, May, there is an increase. Those who have mood disorder, the pink ones are very high, and the general population and those who do not have a mood disorder, they are also having a peak in the March, April, May period. So that's pretty interesting. And if you see that even if depression is more during this, seasonal affective mode is more seen in winter months, the suicide rates are different in some of the months. So is there a link between sunshine and suicide? Some studies says yes, sunshine may protect against suicide. However, some say that it may be influenced by the climate, demographic, and socio-economic conditions, which changes even during seasons, about the availability of work and other issues. Now, higher risk of suicidal behavior has been associated with increased sunshine and temperature as well, but that is in older age groups. Obviously, this kind of, we don't have a last line on this. The researchers are on, many confounding variables are there, but this spring increase of suicide is pretty much consistent finding. Now, from the example of this clinical sciences, what we understood that the biorhythms can affect depression. We have actually in somebody who is depressed, their morning mood is worse, and as the day progresses, they become a bit better. So this diurnal variation of the mood is very well known in depression. I talked about seasonal affective disorder, the premenstrual dysphoric disorder, sleep-wake cycle disorder, and even bipolar disorder also gets influenced. So from this understanding, what interventions are we using, which is actually influencing the rhythms in the body? Let's shed some light on that. Now, sleep hygiene is pretty important. And as you are informed that sleep disorders are so very common, and getting the sleep right is so important. It's not just the sleep disorder. Most of the psychiatric disorders come with sleep problems as well. So one of the ones should do, you have to stick to a routine. You get up, make your waking up time very fixed in the morning. Whatever time you sleep in the night, you should get up at the right time in the morning, and no extra, sleeping of bed in the bedtime in the weekends. Get some regular exercise, only to go to bed when you feel tired. If you're not tired, not feeling sleepy, don't go and toss around in the bed. Only use your bedroom for sleep, to have sex or get dressed. You don't associate bedroom with reading or doing homework or office work or watching TV. Make the temperature comfortable and see that it is dark, quiet. Try to relax, unwind in the hour before going to sleep. Sometimes take a hot water bath or to relax yourself. And if you're not sleeping for 20 minutes and you're still in bed, come out and do something boring. Read a very small print book which you don't like. Then your mind will get tired and you'll go back to sleep. What one should not do, too much of caffeine or tea, chocolate, or drinking alcohol in the evening, smoking. If you exercise just 4 hours, within 4 hours of going to bed, body might be still very excited, so you may not get proper sleep. So sleep hygiene methods are pretty well known and people do follow that. The light therapy, which I mentioned for the seasonal affective disorder, which is like bright light therapy or phototherapy also it is known as. We use that for various things, like seasonal affective disorder is maybe the commonest one, improving exposure to light, but jet lag, other sleep disorder, or adjusting to a nighttime work schedule, or even dementia. When dementia, sleep-wake cycle becomes affected, so people sleep in the daytime and wake up in the night, and for them it might be really very helpful. And sometimes we use light therapy to increase the effectiveness of antidepressants or to avoid antidepressants. Suppose somebody is pregnant or breastfeeding, or it may be possible to take a lower dose of antidepressant if there are side effects. So one can actually use light therapy. Now, this is an interesting therapy, social rhythm therapy. This therapy is basically when the idea has come from that stressful life events can interrupt our daily routine. Suppose we have been affected by either personal or a massive mass scale stress, for example, disasters or wars or other things. So that actually interrupts our daily routine like anything. And then what happens when our daily routine is completely disrupted? our regular exposure to the social, time givers, the jet givers, gets affected. Then there is an instability of the biological rhythms, such as sleep. Very understandable. And when the sleep gets affected, leads to mood disturbances, and a lot of people may develop depression, anxiety, and other things, which we see. What social rhythms therapy says, bring back your usual routine as quick as possible after being affected. And make it very stable, daily routines. Get up at the right time, take your breakfast at the right time, or, and start work, or go to have your dinner, or go to bed at the right time. If you fix these times, there are many things that we do. Up to 5 to 17 items has been not reported to be fixed, and that helps people. Social rhythm therapy also suggests activity scheduling, like where to put which activity, and fix them and keep doing them. So as soon as you reorganize or bring back your daily schedule, maybe that will be better. And it also uses behavioral activation, but they are different kind of therapies. The social rhythm therapy is just not activity scheduling or behavioral activation. It is basically implementing a regular daily pattern. And it can be used with other therapies like interpersonal therapy or cognitive behavior therapy. So that helps. And it can be used in depression, bipolar, PTSDs, and sleep problems. Now, coming to music therapy, I think this must have been sort of discussed. And, music soothes us and makes us feel very comfortable. These music therapies are given by the experts in the music. But music medicine is very much well practiced. Those who are not experts, like other clinicians, psychiatrists, psychologists, or those who can suggest use music. And we use music therapy in depression, anxiety, even schizophrenia, rehabilitation, chronic pain, and chemotherapy in cancer. So music therapy is being used pretty much. Does music is a rhythm. And then does it affect any of our biological rhythm? The answer is yes. And it affects the brain waves, and music significantly increases alpha and reduces beta activity over time. So when you listen music, or even perceive or imagine music, and it affects your brain waves. Very nice, isn't it? So you can hum, you can imagine, or you can listen. It will help you. You see, this is like what happens from beta, fast active, busy active mind. If you are listening, it may become more of alpha, which is reflective and restful rhythms in the brain. Now, another intervention we use is biofeedback, which is a basically mind-body technique. We use the physiological parameters, amplify that, and then feedback to the person, and then they can control. It is basically, we can voluntarily control what was like once thought to be involuntary body processes. We can actually control the heart rate. Obviously, we control our respiratory rate, even the brain waves, and we can see that in the EEG. And we do use that pretty much in manage disease symptoms. Obviously, we need a specialized equipment to amplify the signals. The usual sensors we use, like surface electromyography or EEG, which is a neurofeedback. And other variables we use, like heart rate, respiratory rate, and skin surface temperature, skin conductance. And this is kind of a pictorial description like what happens. And when we give the biofeedback and person learns to relax, they can see that they can increase, for example, here in their alpha waves from beta, very fast activities, through different kind of relaxation processes, breathing exercises, meditations. They can influence their mental state by changing the rhythms, which is maybe EEGs. A lot of disorders are treated with biofeedback. It is amazing to see how many psychiatric or mental illnesses and physical illnesses. And a lot of evidence actually are there for urinary incontinence in female, chronic pain, constipation, epilepsy, headache. But in psychiatry, we usually go for the anxiety, ADHD, insomnias, addiction disorders, depressions, PTSDs as well. Now, slow breathing is a very common intervention which is used, I think, in most part of the world now, mostly in India. A lot of people do that. Slow breathing is basically taking less than 10 breaths per minute. And when you do that, whether you do it pranayam, yoga, or whatever ways, when this breathing is slowed down and controlled, what happens? Easy studies show an increase in alpha and decrease in theta power. Very interesting. And there is functional MRI studies as well. They say there is increased activity in cortical and subcortical structures. That's wonderful. Like we are doing the usual things. Now we are having biological or evidence or rhythm evidence in that it is affecting our biorhythms, making it more calm and comfortable. There is increased comfort, the feeling of relaxation, pleasant feelings, vigor and alertness increases, and it reduces symptoms of arousal, anxiety, depression, anger, and confusion. So I think this is a technique which should be more and more used. And coming to meditation, I think you all know about, definitely more about meditation, and many of you practice as well. And it leads to a deep state of relaxation and tranquil mind. I know there are many ways of practicing meditations. It's just not one way, but ultimately there is a sense of relaxation and the mind is tranquil. And there is a physical and emotional well-being there after meditation. And there has been a lot of research linking meditation and biorhythms. What happens, especially like brain waves, what happens? I'll show you. They actually alter theta and alpha EEG patterns. So if you see in the alpha, there is relaxed or calm or light meditation, and people get more alpha. When there is a deep relaxation, this might change the brain waves, maybe even slower, 4 to 8 hertz, and theta waves. In delta waves, deep meditation and sleep, they resemble each other, very slow waves. So it is definitely affecting. Practicing well in whichever way you are meditating will lead to lead to improving your biorhythms in a way that you feel more relaxed, calm, and tranquil. A lot of emotional benefits of meditation, gaining new perspective of a stressful situation or manage stress, increasing self-awareness, and living in the present. And obviously negative emotions would be less. One would be more imaginative and creative. Health benefits of meditations are also, there is a long list, but many times it helps in this anxiety, depression, chronic pain, sleep problems, and headaches, that kind of thing. Now, in summary, sorry, I have rushed a bit because I think I have overstepped my time. In this summary, recognize the rhythms around you, internal and external, within your body and outside, what is affecting. And recognize how these biorhythms or rhythms are affecting you. And maneuver the rhythms to improve your state of mind and body. The first thing would be sleep well. Use sleep hygiene methods. Stabilize your daily routine. The social rhythm therapy. If you are stressed and all that, don't mess up with your daily routines. Breathing exercise. Use slow breathing. I think you can practice anywhere. Not just you need a morning hour to do that, or you can do it in your office and other places. Meditate. Avoid substances and situations that may affect your rhythms. That's pretty clear. And if the rhythms go disarray or arrhythmias are there, try to bring them back on your own efforts. Find or seek help from or you need from your family, teachers, or clinicians. We are all floating in a vast ocean of rhythms, within and outside. Waves, touches, even ripples, however small. Calm down, enjoy the ride. Enjoy the ride of the waves. You are a part of the whole, and you are the whole as well. Thank you. Thanks for your attention, and we can have some discussion now. Sorry, I think I've overstepped my time a bit.
No, I think you're good. So we'll take some questions. We have Uh, there's a question from, let's see, I thought I saw.
There's a message box, yeah?
Yes, that's right, yeah.
Okay, there is a lot.
Right.
Number of messages actually.
Yeah, there are a lot of. Let me start with the first one. That says early onset psychotic disorders could be predicted with 90% accuracy using only 3 factors: biological, dopamine related pathways, social, and psychological. Okay, that's good to know. On this slide, my question is how likely a psychological and social setback of past could disrupt biorhythms in distant future? Good, absolutely interesting point. I think if somebody has a trauma history in the past, that can reignite, issues in the future. Knowing that and knowing how to deal with those trauma in the past, and now there are trauma-focused cognitive behavior therapy and other things, and it that needs to be dealt. If it has been pushed under the carpet, it might come back and raise its ugly head when you are stressed or when you are a little vulnerable for some other stress in the future. About predicting, I think it's really coming up. Psychiatry is now moving just from assessing or talking to patient, putting the symptom and signs together to make a diagnosis, although that is pretty good concordance in that. We are now actually using, and you will see that happening, so many different variables to diagnose more accurately, like precision diagnosis. So it will be using genetic, physiological parameters, some clinical parameters, besides talking to patients and using questionnaires or scales, as you know. So there are so many ways psychiatry is evolving, and you will see that changing. About predicting, a bit difficult because individuals, but it can still be done. I haven't read the particular paper you mentioned. But I would love to look into that.
It's pretty recent. I mean, it's as recent as in October.
Oh, okay. Yeah, thanks very much. If you send me I'll definitely read about that. About somebody else written about seasonal affective disorder. Are there studies on how Indian season affect people in India? For example, effect of incessant rains and monsoon is a myth or reality that the cycle of moon affects. Okay, good. I think the SAD, seasonal affective disorder studies in India are pretty less because we don't have massive fluctuations in India about the sunlight hours, but there is still issues because we still get winter, and India is a pretty vast country. In the north it is pretty different than to the south. So I think there is a need for more research in seasonal affective disorder. About the moon, I think there are a lot of things that is coming up. Whether in a full moon day or new moon day, we have more, presentation to A&E for psychiatric illnesses. There are some studies, but I think we need to have very large-scale population-based studies to reflect that. I don't think there's that kind of study exists from Indian sort of population. The next one is Pmdd treatable? Yes, absolutely. I think do contact your consultant. We for mood and other symptoms, there are antidepressants which can be given. If the hormones are fluctuating too much, they can even do hormonal treatment and manage. It is treatable, I think, and there can be a lot of interventions available. When I was reading this, I think the only cure is menopause, but you can't achieve that on. You have to go through that, go through the whole, but a lot of hormonal and antidepressant treatment and therapies are available. The next one is, I have a habit of starting on bed. I feel like relaxing after 15 minutes of continuous learning. Do you recommend starting at a study table? if you don't have a sleep problem, you can do whatever you like. Shouldn't be a problem. But if you have sleep issues, then better, use a study table, and because when the sleep problems set in, that's the issue. But it doesn't matter if you are not having any sleep problems. For patients with bipolar disorder, with IPSRT or any other social rhythm therapy, can we terminate the therapy after time or after some time, or do we have to continue as a circulation to recurrence doesn't occur? Excellent point. Whether we should continue, I think if it helps, continue definitely, because that means you are not messing with your rhythms, biorhythms. And as you know, the bipolar disorder is a recurrent disorder. Bipolar or recurrent depressive disorder are recurrent ones. So it's important that you maintain a proper, daytime or like whole schedule. The social rhythm, that get up at the right time and all those things. And if you fix it, it will definitely help. There is time for some exercise, around 30 to 45 minutes or 1 hour, and that might help. Whether it will prevent or not, I think we need more research or, high-end evidence to say that, but definitely it will help. Does PMDD continue even after hysterectomy? I don't know. I don't think I'll be able to answer that unless I search, because there will be no, menstruation after this hysterectomy, but there will be fluctuations in the hormones, and if that is affecting the mind in some way, or having these mental health symptoms, do discuss with your doctors. They might ask for hormonal treatment for that as well. And yes, Dr. Roy has sent that link. Excellent. Thank you very much, Dr. Roy. I will definitely go through. I think this is the opportunity for us to, when we interact, to learn. Excellent. I will go through that.
Sir, may I ask a question, sir?
Yeah, please.
Just, sir, I attended American Academy of Sleep Medicine, an international conference in June this year, Sleep 21, where the keynote speaker said that unresolved emotions are the cause of sleep disorder and sleep-related issues. So emotions need to be dealt properly and resolved. This was the basic message which we gave in the keynote address. Now, my question to you is, do you think that we need to have our emotional intelligence leading to emotional quotient evaluated over a period of time, or what could be the time frame we should look into?
That's absolutely a fantastic point. I think most of our patients we see are actually, they're having sleep disturbances because of an emotional issue or an unresolved issue. Because in psychiatry, we see hardly a sleep disorder, those who are having uniquely just sleep disorder. Mm-hmm. Most of our mental health problems come with these sleep problems, and they are actually laden with emotional issues, which is unresolved. So cognitive therapy is pretty important, and many times we do suggest that. So that means they need to come out, discuss those things, those emotionally unresolved issues. Sometimes trauma-focused CBT, if the emotional issue is so much that it has been traumatic, that needs to be resolved, yes. And many times that may not be in the forefront, and the person might be having sleep problems. So many times with a detailed discussion and finding out helps, and to resolve those trauma. Many times through different kind of perspective, taking the different perspective of this trauma, other coping strategies.
Measuring the emotional intelligence.
Yeah, emotional intelligence, I think that also would help. Obviously, I'm coming from a very clinical science perspective. We haven't used, but my psychology colleagues, yes, they might be using that. And emotional intelligence is a pretty big thing, we are not using in clinical science that much, but it affects our life, work life, family life so much with interactions. And many times those kind of gather and affects our psyche.
So I would like to add one line more here, one more line, sir, that we have developed a tool, or I have developed as a part of my PhD doctoral work, a tool called Vibu Scale, which enables in the Indian context to measure the emotional intelligence, which can help many other sleep disorders as well as mental health issues. Thank you so much.
Please do share it with us if you can, and we will definitely discuss that. Thank you.
Thank you so much, sir. Thank you so much.
Thank you, Dr. Nirmal Kaur. And I'm sure that if our participants have other questions, they will be able to write emails to you, and I'm sure that I'm sure they'll want to learn more from you. Thank you so much. Thank you so much for this absolutely enlightening talk. So can we move on to the next session? Okay. So thank you, Dr. Nirmal Kaur.
Thank you very much.
We are going to move.
Thank you so much.
Next theme lecture. This is theme 4, Rhythm and Positive Psychology, and we are very, very fortunate to have Dr. Tanushree Dattu. She is an associate professor of organizational behavior and neuromanagement at IIM Ranchi. Dr. Tanushree Dattu is with the IIM Ranchi, and she has been working in the institute from 2012. Prior to this, she worked at the Institute of Technology Rajasthan and Banaras Hindu University. Dr. Dattu obtained her postgraduate and doctorate degrees from Banaras Hindu University and Indian Institute of Technology, Kharagpur, respectively. And she has research publications in peer-reviewed national and international journals, which have been cited in manuscripts and books of national and international repute. She also has, to her credit, an edited book titled Bias in Human Behavior and Neuromarketing in India, Understanding the Indian Consumer. We are very, very thankful to her to agree to give us a talk. Dr. please take over the stage.
Thank you so much for that introduction. And I would request Orchi if you can just play that video because of internet connectivity issues. I'm not very sure whether I'll be able to see it through. So you could just play that and then I'm prepared to answer the questions.
Yes, ma'am.
Greetings, everybody. At the outset, I would really like to thank Professor Patnaik, who is for giving me this opportunity to speak on the topic on rhythm and positive psychology. Now, before I move ahead into my presentation, the image on the screen basically suggests that music is life, and that's why our hearts have beats. And talking of psychology, it's all about behavior, life, and living. So therefore, if we combine both, there is definitely an impact of rhythm and positive psychology. So in the slides to follow, I would basically be talking about the relation between rhythm and its impact on behavior. And then I would be sharing a study which has been initiated and is in the progress and has not been completed yet. And I would end with asking for suggestions from the audience for improvement, and that's how the presentation would proceed. So moving ahead, when you talk of the rhythms that govern mind and body, there are several rhythms that do it, but mainly we talk about circadian and infradian rhythms. So the circadian rhythms, which we are aware of and which most of us and maybe all of us are aware of, are rhythms which relate to 24 hours. So there are sleep, and based on that sleep and awakening patterns that we have, and based on that we have a morning or a night person, which is also at times referred to as the larks and the owls. And then there are other examples of circadian rhythms, which include the melatonin and secretion, cortisol levels, etc. With respect to infradian, which is exceeding 24 hours, so and that is for a longer duration, and they are usually monthly or seasonal cycles, and it is not restricted only to humans. You find that in animals and even in plants. So examples such as breeding, mating, migration, these are all examples of infradian rhythms that are there. And interestingly, these rhythms too have a major impact in our lives. So talking of circadian rhythms, if you remember, or if you've had any experience, you'll see that when it has been time for your sleep and you've missed it for any reason, for any work or anything, then it actually has an impact on your life and the way you feel. So therefore, these rhythms have always been very closely associated with human behavior and the way life is lived. Moving ahead, it has been found that a disruption of these rhythms actually have an impact on aggression also. So here what we have is, I mentioned, is about reactive versus proactive aggression. So these are two different types of aggression which we're talking about, and let's understand them first. So proactive aggression is basically low arousal and is a calculated behavior with minimal or no provocation, right? So that's the type of aggression that you show to people. So the intention of any proactive aggression is to obtain some reward, something which is rewarding, and there are studies which has happened related to this. So an example of a proactive aggression would be an elderly child moving towards a younger one and trying to bully or stealing the money. That's basically intentional and thought about, and that would be an example of a proactive aggression. Talking of a reactive aggression, reactive aggression, unlike proactive aggression, which is more calculated and known beforehand to the person who's going to exhibit it. Reactive aggression is basically more of a reflex, right? So it is an impulse and therefore it is less planned or thought out. And that's the reason why it happens as a reflex that it comes over. So therefore, this is basically the difference between reactive and proactive aggression. But studies suggest that when there is a disruption of normal circadian functioning, this triggers the incidence of aggressive behavior. Now, when this triggers the incidence of aggressive behavior, then and chronic expression of this anger then disrupts the normal rhythmic cycle and create pathologies. So if you look into it, you find that there is an impact of rhythm into behavior, right? So a disruption of rhythm, if it has these consequences, this is of course based on a research which is already available. So you can then imagine the impact, the positive impact it would have on us if these rhythms are actually maintained. So then moving ahead with this, there was a study which we had done on rhythm and behavior. And the study is still ongoing. So I'm just sharing a brief result of the studies which have just started to come in. There's more work to be done. So in this particular study, what we tried to do is we tried to measure the interhemispheric transfer of information in the brain and in the presence of rhythmic sound and noise. So rhythmic sound would have a rhythm, would have a beat, and noise would something which would lack it, right? So that we wanted to actually check what is the impact of rhythm or noise on any task that a person is performing. And in this situation, the task was very specific to interhemispheric tasks. So there was a transfer of information from one hemisphere to the other. So the study which was conducted basically had these three parts, and this is what I'm going to explain to you. So the first part, we had a summation task. So there were arithmetic problems which were given, and the people had to work on them. The second one was on picture and word jumble task, and that was a combination of it. And then there was a picture task and a sentence matching task which was there. So in the summation task, if you see, the participants basically had to compute the sums. An example of it is shown in the picture. And they had basically, so when you're trying to solve mathematical problems, you're basically using your left hemisphere. But and they were asked to respond using their left hand. So when you are processing numerical information, you're actually activating your left hemisphere. But when you're responding with your right hand, you are basically activating. You're responding with your left hand. You're basically activating the right hemisphere. So there is an interhemispheric transfer that is taking place. So that was one task which was given to them. And then the second, there was a picture and a word jumble task. So the participants basically had to respond verbally. So the brain was activated by the picture, and the picture, there's a right hemisphere activation that takes place. And then there's a word jumble task, and the word jumble task is basically an activation of the left hemisphere. So this is what they had to basically, the task was all about. So in the word jumble task, what they had to do was they had to arrange the following words to make a correct sentence pertaining to the picture. So the picture is basically a right hemisphere function. Words basically are a left hemisphere function. Again, the performance was basically measured. And in the third situation, there was a picture and sentence matching task. So the task gets a bit more complex. So here there are some words and you've got to create a sentence. Here there are sentences and you've got to put them in the correct order. Again, there is use of an image and the use of words. That's both the hemispheres are being put into work for that. The interesting thing, which was that these tasks was basically conducted, these tasks, the performance had to be, a person had to respond to this task or perform these tasks in the presence of a rhythmic sound, and ASMR was used for it, and or there was a noise situation which was available. And in these situation, the person had basically to perform the task. So the whole experiment was repeated thrice. So one was the normal condition in which there was no interference given or no interference task was introduced. And that served as the baseline of the control data. And therefore, in the next two in the next two type of tests that we performed, the results were basically to be compared with the baseline data. So that was the design of the experiment. So these subjects is basically to perform the task once in the presence of ASMR. For ASMR, calming noise was used, and that's available on the internet. And one using noise, and for noise, loud incoherent sound was used that was also taken from the internet. And these were the three conditions that was present in which the subjects had to perform, and the responses were recorded in terms of the number of errors that they made and the time that they took. It was made sure that all the participants hear the same sound with the same volume, so we're keeping all things constant so that comparisons would be more effective. EEG was used simultaneously for observing the interhemispheric transfer. The response time was also noted down. And when the expectations, if you actually look into, I'll just move this from here, and the expectation that is based on available literature, if you check onto, so it has been found that ASMR has a tendency to increase brain activation. So information processing would be faster. Participants would take less time. When there's a noise situation, now noise increases stress, and it has been found that since it increases stress, there is an impairment of cognition that happens. And that's the reference of the paper that we've quoted. So it alters the neurotransmitter levels in various regions of the brain. And therefore, due to that reason, you find that there is a decrease or a decline in performance. So that was basically the study. And then we collected data. We've not collected much of a data, but yes, it's still in progress and work is still going on. But what we find in that study is basically the results that we find, no doubt in the noise condition, the performance went down. But very interestingly, what we're also getting is that a few among them were actually able to perform better in a noise condition. Now, gone by that, since we've not conducted the study on a larger sample, we are not in a position to suggest why this has happened. However, we do believe that there are other factors also which may have played a role. So a comparative study between the novelty of this particular study which we have is that a comparative study between the three states have not been done earlier. So there are studies which have tried to measure performance based on in a noise condition, or there are studies which have been done to actually see what happens when there is a rhythmic sound that's given. Here we've done a comparison across three situations, and that's where we claim that a study, or even if it's done, we are not aware of it. So that's how we design and pitch in this particular study. The observed results were similar to prediction as we have thought about. So we did find that people were performing well in a ASMR condition when there was, not in a noise condition. But as I actually pointed out to you, the fact is that there were a few, the one or two of them, where we found that they were actually able to perform well in a noise condition also. So we need to probe it further. And for this, I think we actually need to conduct the study on a larger sample and look beyond just the EEG data. There may be other factors also which play an important role. So more cases are needed for generalizability of results, which we are in the process of doing, and where I look forward to your suggestion in case you have any to suggest how we can improve on, or how we can actually take the study forward, by which we actually come up developing a meaningful study with some interesting results. So the combination of the different brain waves of alpha, beta especially would yield deeper insights, and we are also looking into that aspect. But as I told you, it would take some time. But yes, I just wanted to bring a small part of the study which we are engaged in to show that yes, it is actually true that in the presence of rhythmic sound and not noise, performance is actually enhanced and people actually tend to do good. So with this, I really open up to any suggestions if you have, and would love to hear from you on how I can improve on the study further, or your take on this. And with this, I would like to end with my presentation. And these are the references that have been used for the particular study, for this, preparing the particular slides. And thank you so much for giving me your patient hearing. I look forward to listening from you for your suggestions. So thank you once again.
Thank you, Dr. Tanushree Datta. We have a few, I think, questions, or at least I see at least one question in the chat box from Nirajana Ghosh. Yeah, so if you could take that.
The role of the ASMR was basically to give a very rhythmic sound. So ASMR music, the sound is available on the net, and if you check up, you'll find that there are a very systematic way of the music that is presented. So that was basically used. The idea was that if there is a rhythmic sound that's being played at the back, does it actually have an impact on behavior or not? On the performance. Noise, of course, is something which is expected to be disruptive. So that's basically the role of ASMR, of using ASMR in the study.
Thank you. Anyone else with any questions?
Yeah. May I ask a question?
Sure.
Yeah, please do. Yeah.
It was a beautiful concept which you presented, but I just would like to add that in the banks and in the service sector, we have been noticing that there are soft music, which is instrumental music, it could be, or it could be vocal music also, and a very slow tempo it plays. Even in certain road crossings, I have observed it. Now, my thinking is that, maybe as you are saying, that if this music is on, even while teaching in the class also, I have felt that students don't listen at times. So there also, if there is a light instrumental music which goes on, I think that activates the brain. And maybe as you are saying that the left and right brain activity can be enhanced to a great degree. I think the service sector, in which India is actually the prime giver to the world, we can actually train people in an effective way for better delivery in the times to come. So it has got a huge application in various sectors in service sector, and it could be seen in various banks, other educational institutions, etc. If it could be studied this way, as you are saying, and made a total compilation and coming to the actual results of what it actually means.
Yes, ma'am. I really agree with that. That's a wonderful suggestion. And in fact, since we are still in the process of collecting data, we could simulate some task and then, do it with people who are working in different sectors and try to find out exactly what is the impact of it. That's really nice.
It will be very nice, because yes. I think the education sector, the teachers, the professors, because we undergo a lot of stress while teaching children and not willing to learn, So because they know a lot from the internet, it's no point. So I have resorted to a different way of teaching, where we say, open the internet, see what is there in this, tell me, I will write in the board, and then the discussion starts. So there if the soft music plays somewhere behind, the activation of the brain happens. I think excellence in education and service sector is bound to come with the time, because Indian music is so much so that it helps us to think in multiple ways and have, I think, 1,000 solutions to a single problem, and getting a solution to a problem shall never be a constraint for anyone. So I think this research of yours can go a long way, and would be very nice to be associated within some capacity. And yes, that's it, I would like to say. Thank you so much.
Thank you so much. It was really encouraging, and I will get in touch with you definitely.
Thank you so much.
Thank you.
Okay, do we have any more questions? So if I may use my prerogative, Dr. Tanushree, I was wondering in the study that you mentioned, the interstimuli, I mean, timing. So in a sense that the brain also has, I suppose, inhibitory mechanisms, right? So once you activate something, how long does it stay activated before it gets inhibited? And does that really affect your studies?
Just let me understand the question in my way. So are you asking me that, when we have initiated a task and given the person a task to perform, and then we've done the brain mapping, so how long have we been able to see the activation going on? Is that the question?
That's right. Does it get sort of, how fast does it sort of stay activated? Because I'm assuming that there are inhibitory responses as well, right?
Okay, I got it. So in this case where we're using EEG, our main purpose was basically to measure whether the interhemispheric transfer was happening or not. So we were more interested into that. So once the person was made to sit in front of the computer and the task came up one by one, and the music being played at the back end. By the EEG analysis was basically being done to see whether one hemisphere is getting activated and whether the transfer is happening or not. And that's exactly what we have looked into primarily as of now. But then that's a good suggestion. And I would relook into the data to find out exactly what's the time duration of the thing. I mean, how long does it continue even after the task is over? That is what we've not yet looked into. Yes, we can look into it. That's interesting. I mean, that would give us interesting insights also.
Okay, we might be able to, I think, squeeze in another question if anybody has one.
May I?
Yeah, sure.
Yes, please.
This is just a small question. That is because I worked with visual stimuli, and I in literature review I have seen there are the topic of lateralization is hotly debated. So, what's your view on that? I mean, the segregation of hemispheric segregation, that's quite debated. I don't know which is true, but I've seen literature that says the whole brain, the total brain is activated. Some say they're hemispherical activations. They're both equally either denying or I can accept both or I can deny both. I don't know. What's your opinion on this?
No, I completely agree with you. It's not about my opinion. Yes, you're right. I've seen literature myself also indicating such. But when you place it, I mean, try to see it on EEG, you do get to see an activation which is there. But then there are specific centers which also show activation. So, you can actually see that. So in this particular study, we were actually able to see this, that, one center gets activated and then suddenly you find that the other center is getting activated and then back again to it. You can actually see that. But yes, you're right. It's not that very clear, right? So one center getting highlighted and then you see, no, it doesn't happen like that. But yes, you can see a certain change in the activation pattern that takes place. And when that activation is happening, it doesn't mean that the rest of the brain does not show any activation or anything of that sort. No, there is activation, but they are less. And then there are specific centers which get activated and you can actually see that.
Thank you.
Madam, I had one small suggestion to add. May I?
Yes, ma'am.
This is there's something called mood elevation theory, and that is which says that the right kind of music actually affects need to match with the emotions of the mind at that point of time in order to get it activated. Now, my question to you is that there are some people who may not like music, so the playing of the music may not, if I go by the mood elevation theory, they are in a different mood, the music may not match and they may not like. So that may not affect the performance in that case. We need to look into this aspect also.
Yes, you're right. Because, in one or two of the cases that we've analyzed so far, we are also finding that the systematic sound being given is also disruptive for those people. So when we try to look into it, why this happens, we found that if there's a constant beat sound that's happening, it at times gets irritating. So that's specific to people. I mean, we need to collect more data to find out what exactly is happening into it. But the point is, even in our day-to-day experiences, if we look into, so many a times that happens if there's a particular beat which is continuously being played and you get to hear it for a long time, it becomes irritating at times, right? So there are different impact of different music that you get to see. So it's a bit complex, and we really need to look into it from a variety of angles to see what exactly plays an important role.
In this case, probably we can look at the IQ, EQ, SQ and such factors in order to know whether what is the alignment of those, because there is some problem or issue because they are not responding to the music, which at least 90% people are responding. I think that parameter can be looked into.
Yes, and I think, yeah, absolutely right. And I think, we can also look into the fact that to extent the person likes music or has loves music or follows music, and the impact that it has on those type of people. And those type of people who are just casual about it and get an impact on them, that can also be looked into.
Right. Whether they are passionate about music or some other art form, that needs to be identified before we put them into the control or the other groups.
Yes, so I think I'm getting your point right if I say that it's about profiling the participants well, and then trying to come to a conclusion that, what exactly is actually working into it.
Right.
Okay, thank you, Dr. Tanushree Datta. That was really very, very enlightening, and all of us learned a lot. At least I know personally I learned a lot. Thank you so much, and I'm sure that if anybody else has questions, they will be emailing them to you. So thank you very much. We are really appreciative of your giving us your time.
Thank you.
With that, we'll move on to our next themed lecture. This is theme lecture 8. We're just about a little behind schedule, but we should be good, I think. And this lecture will be delivered by Dr. Sean Carmichael, and I find it a distinct pleasure to introduce Shomir, and I can sort of, we are on a first name basis because, he was the former director of the School of Languages and Linguistics responsibility that I have been given at the moment. So I have to really fill very, very large shoes because of the fact that Shomir is just an absolutely fantastic researcher and a really, really great scholar. But I will use this opportunity to formally introduce him. Dr. Sean Carmichael is an assistant professor and former director of the School of Languages and Linguistics in Jaipur University, and has a PhD in linguistics from Indian Institute of Technology, Kanpur. He did his master's and bachelor's in linguistics from University of Kolkata, University of Calcutta, India, and Dr. Carmichael has published several papers in different disciplines of linguistics, like psycholinguistics, pragmatics, and discourse analysis. His current research interests revolves around the structural and acoustical nuances of Bengali language, its acoustic correlates, and their effects in human brain functions. He's a member of different linguistic societies like Gesellschaft für Semantik in Germany and Linguistic Society of India. Today, Dr. Sean Carmichael will talk about rhythm of positive communication, language and speech, poetry. So thank you, Shamir, for agreeing to give us a talk, and you may begin your lecture.
Thank you, Professor Doctor, for introducing me to this particular session. Before I start, let me to just check whether these slides are visible.
Yes, it's visible.
Yeah. Okay. So thanks also to Professor Teodosi Patnaik for giving me a chance to introduce this particular theme. Initially, the theme was rhythm of positive communication, language, speech, and poetry. But while working on this topic, what I found that whatever thing that I am going to talk today, it actually holds true not only for the positive communication, but it also equally holds true for the communication in general. And that's the reason I have decided to reduce the topic into this one: rhythm of communication, language, speech, and poetry. And it's mainly because of the reason that often in linguistics we really do not make a distinction between positive or negative. We don't even say that which one is grammatically accepted form and which one is not grammatically not accepted. Okay. In fact, in linguistics, what we have noticed that grammatically not accepted forms are also equally important to make some important inferences about the linguistic cognition or about the linguistic competence. Okay, so that's actually motivates me to restrict my talk on the topic of rhythm of communication, language, speech, and poetry. So let me to go to the next slide. Okay, so there is also, and when I have started to look for the definition of positive communication in different literature, what I found that they are defined in this way: positive communication creates contact, positive communication discovers the unknown, positive communication affects the self, positive communication deepens relationship, positive communication gives support, positive communication transcends separateness, positive communication influences others. Now, if you look at those at these definitions, what you will notice that all these definitions actually holds true also for communication in general, and this simply the reason why I have decided to drop the term positive. Okay. Now, why we need to actually drop the term positive? Because what we found that if we add the term positive to the word communication, we are actually getting us involved with the particular politics of fixing certain standards of speaking. Okay, and needless to say, linguistics stands strictly against this type of prescriptivism. So we are not going to prescribe in which way you can communicate something positively. Okay, so under this situation, then linguistics will take us to a discussion on the different alternatives of communicating a single thought, and this particular point that we will be elaborating in my next in the following discussions. Okay, so here in this slide, as you can see, I have actually quoted Jivanananda Das. Jivanananda Das, even after being wrongly identified as the poet of despair, has shown how a man can become a most successful modern poet even after living a life of extreme solitude. Should we consider this voice of solitude as the celebration of negative communication? Someone has rightly said, Jivanananda arrives at his own philosophy and builds his own world, which is never a negation of the actual one, but is the same living world organized more truly and proportionately by the special reading of it by the special poet. In his article on what should be the form of language of a poetry, Jivanananda denies to accept the imposition of a standard. This stands, as I personally believe, true not only for the poetry, but also for the speech as well as the language. So here, what I have done, I have actually given poetry by Suimal Bosak, who belongs to this Hungry generation movement, literary movement, and those of you, if you can go through this particular poem in Bangla, you will notice that it is actually full of many negative imageries. Okay, but when do we say that this is the way negativities are being communicated? That's definitely not the case. Those of you who has no access to the Bangla, you can actually go through this. I would not say this is a better English translation of this particular Bengali poem. Rather, it's rather bad translation, but still you will have some understanding of the content of this particular poetry. So the researchers working on the positive communication often in a wrong way put emphasis on the form of the expressions. If one follow their approach, then she will simply ends up with a conclusion that the slogan "no means no," to emphasize the issues of sexual consent as something negative because of containing negative expressions like no. Often these approaches will tell you to stay away from the negative words, to see something good in the bad, and if possible, to provide alternatives and to set expectations. What they fail to realize, neither the alternatives nor the expectations are individually created or produced. In fact, they are determined socioculturally in a given point of time and space. The appeal of communication strictly depends on two distinct but interrelated issues. The first one is the communicative intention, and the second one is the way communicative intention is crafted as a form of communication. As per this view, then, this particular poetry written by Subimal Bashar is not an instance of negative communication because of being contained with the negative imageries of his own time. So, like poetry, speech is also not a mere static statement which one can evaluate or investigate in terms of its imagined constituencies. Speech is a form of action. As a form of action, it not only connects an individual with other individuals, but also creates, recreates, and most importantly, changes the world. The individuals that creates the world where the individuals lives in. Speech is the embodiment of three distinct forces, namely locutionary, illocutionary, and perlocutionary. They are alternatively known as function as well as action. Locutionary function is the result of three distinct types of acts, namely phonic, phatic, and rhetic acts. The phonic acts are significant in providing the phonological information of a speech form. Phatic act is significant from the viewpoint of the syntax and morphology. Rhetic act is all about the semantic and the pragmatics. Locutionary function is embedded within the illocutionary function, which is about the speaker's intention, whereas the perlocutionary function is important from the viewpoint of hearer's perspective. Now, if we consider speech as a form of action, then communication is definitely a space defined not by the positive or negative forms of the utterances, but by the dialectics of the interactions constitutive of that particular space. So, here are certain observations. So while working on this theme, I just thought it would be better if we can have some examples. And what we notice here, that some same illocutionary goal can be successfully attained by means of different locutionary functions. So just I like to tell you that if you can recall what we have said while presenting the previous slide. So in previous slide, we have told that locutionary function is about the three distinct type of actions. Okay, so one is the phonic action, another is the phatic action, and third one is the rhetic action. So phonic action is all about the phonological structure of a particular utterance, whereas phatic action will give you some information about the structure of the sentence, structure of the words. That means you will be getting information about the morphosyntactic configuration of that particular utterance. And in rhetic, when you are actually approaching that utterance from the rhetic viewpoint, you will be having some understanding of the semantic and pragmatic information. So, okay. So please note, irrespective of the differences in their respective locutionary functions, each of these three utterances, here the utterances that I have given here, that are return ticket to Kulpi please. So you have gone to a railway station ticket counter, and you can say any of these three you can articulate any of these three utterances. You can either say a return ticket to Kulpi please. You can also say, can I have a return ticket to Kulpi please? Or you can even say, I'd like a return ticket to Kulpi please. Okay, now in these three different cases, what you will notice that all of these three different utterances, they are actually referring to a single illocutionary act. They are referring to a single illocutionary act, but at the level of locution, they do differ from each other because of having different type of lexical expressions within themselves, and at the same time different type of phonological coding. Okay, so here in this case, what would like to say that in case of alternative one, what you will notice that when you are saying that a return ticket to Kulpi please, you are actually asking in the disguise of stating a fact. And when you are saying that can I have a return ticket to Kulpi please, you are actually requesting in the disguise of asking. And when you are saying I'd like to return I'd like a return ticket to Kulpi please, then you are actually asking in the disguise of wishing something, wishing something. Okay, so you are actually you are looking for a particular ticket. Now, with the change of the locutionary functions, underlying phonic fact and rhetoric aspects will also get changed. So it's not the case that only the locutionary function gets changed. So when we are saying that locutionary functions are different in case of these three alternatives, you are actually talking about the differences that you can notice at the phonic level, at the phatic level, and as well as at the level of rhetoric. Not only the circumstance, but also the faces of the interlocutors are construed accordingly. Okay, so when you are asking in the disguise of stating a fact, the way your face will be constructed, and when you are actually requesting in the disguise of asking, your face will be constructed in a different way. Okay, so this is the point that I want to make here. Okay, and as a result, what you will notice that to conclude, alternatives are not only about the worlds made up of discrete units, made up of discrete units. Okay, sorry. To conclude, alternatives are not only about the worlds made up of discrete units. Alternatives are also about the non-discrete continuities. Study of the alternatives, therefore, may reveal some important insight about the way discrete and non-discrete aspects of communicative intention are interacting with each other while engaging or disengaging an individual rhythmically. So let the happiness prevails in this process of disengaging or engaging with the others. Now, if you look at these three different alternatives, these three different pictograph of these three alternatives, what you will notice that they do differ from each other in terms of their respective phonic representations. Okay, and when we are actually talking about the rhythm, so unlike the other cases in case of linguistic communication, what we have noticed that it's not the notion of the periodicity which plays an important role to communicate a sense of rhythm. Okay, in fact, aperiodic wave can also have a certain type of rhythmic element within itself. Okay, and how we are actually studying rhythm in linguistics? We are studying rhythm in linguistics in terms of the pitch, in terms of the intonational pattern, in terms of the pulses. Okay, in terms of durations. Okay, so we just break down a particular utterance into these constituent parts. Okay, so whatever choice we are making in terms of these alternatives, that will definitely have some effect on the phonic construction of the utterance, on the rhetoric construction of the utterance, as well as on the phatic construction of the utterance. So what I found that when we are talking about the communication, when we are talking about the rhythm, when we are talking about the rhythm in case of this verbal communication, probably we do need to keep all these things in mind, because there is nothing called positive or negative in case of the linguistic communication. So everything is communicated successfully. Okay, so that's the matter we are actually worried about most of the time. So this is the thing that I want to present here in this session. Okay, so with this, let me to thank you all. Thank you for your presence. So if you have any queries or questions, just feel free to ask me.
Thank you, Shamir. That was quite an illuminating talk. Let us see if we have questions in the chat box. We have Mitali Chaudhary saying that they agree with you.
Yeah, I agree with social reason of the negative in psychological behavior or mind. Okay, it seems it's a observation by Mitali Chaudhary. Yeah.
So if anybody else has any questions, please unmute yourself and.
Sir, if I could ask, sir.
Please.
Communication is that important that we wish to say something to someone. And as you said, like there is nothing called positive communication, it is communication. Now, there are certain things, certain times when we want to say something which needs to rectify a person or put the person's, whatever you say, things in the right perspective. How do we use the communication, maybe in the pitch or in the tone or the way we say it, so that whatever we say, although not very pleasantly, seems pleasant to the ears? What would you like to comment on that?
Yeah, ma'am, actually, when we are studying a particular type of utterance, as I have shown to you, we are actually approaching it from three distinct viewpoints. One is the locutionary viewpoint, another is the illocutionary, and third one is the parlocutionary viewpoint. Now, suppose you are trying to rectify something, and you are actually trying to suggest something to someone. So two things is happening from the viewpoint of the speaker. One, what the speaker is doing, speaker is actually producing that utterance. That means from the viewpoint of the speaker, you can study that utterance and you can say which type of locutionary forces are actually connected with the utterance. Okay, so locutionary forces means, again, you can actually break into the study of the phonic aspect, rhetoric aspect, and phatic aspect. And along with this, you also have the illocutionary viewpoint. That means, what do you want? So you are saying that, okay, seriously, cigarette smoking is not good for health. Okay, so what do you want? You want actually that your addressee or the hearer should quit the smoking. Okay. Now, if the hearer quit the smoking, then your suggestion is, your advice or your suggestion will be considered as successful, because as a parlocutionary effect, you manage to elicit the expected result or expected outcome that you want to. Okay, but what we noticed while studying this, studying the literature on the Speech Act, we found that it is not always easy to say something about what is going to happen at the parlocutionary level. Okay, so say for example, I just want to give a threat to someone I want to just give a threat to someone. Okay, now whether that addressee will feel threatened or not, that does not depend on the intention of the speaker. Okay, so it solely actually depends on the intention of the hearer. So he may feel threatened, or he can even give a opposite threat to me itself. Okay, so ma'am, what I will say that how till the illocutionary force, that means locutionary, what is happening at the level of locutionary and what is happening at the illocutionary, we still have some understanding, but how our modulation of the prosodic feature can bring out the expected outcome from the hearer, if you ask me this question, about that we really do not have much understanding. Hello?
Yes.
Yeah, thank you. Thank you, Sean. Anyone? Yes, please go ahead.
Yeah, well said. Actually, when we interact with our children or somebody who needs an advice, there are difficult moments. But I personally feel that, as you said, the intonation and the choice of words and placing things in a manner in which we can illustrate the consequences of an action probably would be nice, rather than hitting the person with strong words or a strong message. Like, that's what I think in the long term we need to think on those areas, because I think whenever we are a little stronger, that tends to disturb the relationship between people who are very closely connected. So this is what I felt. That's why I wanted to know, since you are speaking in these lines, how can we better ourselves in our communications when we are interacting with people around? Thank you, sir.
Yeah, ma'am, actually what seems to me while going through these different works on this positive communication, what I found that most of the time actually people are putting more emphasis on how one thing can be, or how you can put something in a positive way. Okay, but this is required, but there is also another aspect of the communication which is often being actually ignored. What we found that how you will craft your thought, okay, that also have some impact on the prosodic structure or the intonational pattern of a particular utterance. Okay, and probably we need to look at these particular things, how this phonic level and the rhetoric level as well as the fatigue level analysis structures are interacting with each other. That we probably need to understand, at least at the level of research. Yeah.
It's a very fine moment for interaction of lot of factors bringing out the wisdom, intonation, sentences properly drawn up to lead the message to the hearer.
Yeah.
Thank you.
Okay, thank you, Shamir, for that very, very interesting and illuminating talk. I have questions for you, but we are going to meet the office. So I will ask you then. So with that, I'll take the opportunity to thank Shamir for delivering a very good talk. Thank you so much. And now we will, I suppose, move to the next session. So thank you to everybody for being here and for making this a very, very successful session.
And thanks to Professor Imran also for moderating this session for all of us. And now we will close this session as of now. And we will join again at 5.